Namaste and good afternoon, everyone. A very warm welcome to our 13th session of Web Cares presented by Web and Apollo Hospitals. Thank you so much for taking time off from your busy afternoon schedule to be here with us. I'm Dr. Srinidhi Chidambaram from Apollo Hospitals, and it is my pleasure to anchor this session today. Today's session, as you know, is about women, work, and pelvic health, why your leaks and pain and urgency deserve attention and cannot be ignored. I want to begin with, of course, our usual observation that as women entrepreneurs and as busy professionals, you are probably constantly balancing multiple roles as mothers, as people running families, teams, businesses, startups, but also traveling a lot, supporting your elderly parents, perhaps, sitting through long meetings, unearthly schedules, as well as a lot of stress, and often pushing through any small symptoms or discomfort that you may be having, because that's something that can be managed. And that's just one more thing to take care of, really, and that can wait. So, here, what usually gets neglected is your own health, and very often small symptoms which can easily be resolved. And this, of course, includes urinary leakage, pelvic discomfort, bladder urgency, frequent urination, recurrent urinary infections, heavy feeling in the pelvis, pain during periods, a lot of them, which are often ignored because they're simply too manageable, they come and go, or they're simply something that can be pushed through, or many times something that is uncomfortable to talk about. Also, we assume that these things are normal, part of being a woman, normal after childbirth, it's part of aging, menopause, I just have to adjust. But that's not always true. Pelvic floor issues can happen for many reasons, which Dr. Meera Ragavan is going to discuss with us, and I'm not going into that in detail now. But what I'm trying to really tell you is that pelvic health symptoms are common. They can be managed, they should be addressed, and they should not be dismissed. And also, I think these are our bodies, and I think there's nothing to be embarrassed about. These are not awkward. And I think, especially when effective treatments are available, specialists are available, and these treatments are often something as simple as lifestyle changes or physiotherapy or exercises, as well as more advanced treatments. I think that is why we are exactly here today to discuss in a very safe space where we can ask questions freely. We have an expert present, and we should understand what these problems are by the end of this session and take help if necessary. So, I am delighted to have with us one of our most well-known specialists and experts, particularly in this area, Dr. Meera Ragavan, who is a senior consultant obstetrician and a urogynecologist from Apollo Hospitals, Greaves Road, Chennai. Dr. Meera brings over 2 decades of experience in women's health with training in the UK and a fellowship of the Royal College of Obstetricians and Gynecologists. She specializes in pelvic floor disorders, the very condition that we are discussing today, including pelvic organ prolapse, urinary and bladder issues, and other complex pelvic health conditions as well. She is a very well-known surgeon, particularly known for her work in minimally invasive and robotic surgeries. And above all, what I think she is known for is that warmth and clarity that she gives her patients, putting them at ease, especially as these are very sensitive issues. Dr. Meera, thank you so much for joining us today. And before we actually move on to the many questions that we all have, I would like you to give our viewers an introduction about what the pelvic floor really means, why problems happen, and what is common, what are the early signs, what are, and even a broad overview of what options are available. I know it's a large topic, but let's have that walkthrough with you first. And then we have a lot of questions as well.
Sure. Thank you, Dr. Chidambaram, for the kind introduction and setting the preamble for today's session. As you rightly put, women, especially busy women who multitask, tend to push through this not so comfortable situation, mainly because, yes, it can be pushed through. Secondly, because they do not feel quite comfortable about discussing this even amongst their own close friends or kith and kin. Sometimes they hide it even from the spouse and the partner. And most of the time, it's about not being aware whom to approach as well. Because it might be thinking that you have to approach your family physician. Am I okay to just go to a physiotherapist? It's all about Kegel's exercises on the YouTube. Or should I be talking to a life coach? Shall I go to my trainer and ask about it because I do exercises? Or should I quit exercise at all because it seemed to have worsened with it? Or is it because I'm putting on weight? So shall I go to my gynecologist or go to my endocrinologist or go to a urologist? So many questions crop up even about just thinking about this as a problem. So this unawareness or this difficulty in making a choice of whom to go to itself prevents many people coming forward to seek help or even talk about it openly. So, very aptly, this World Incontinence Week, which is usually observed in third week of June, had this theme this year saying even a small conversation can change many a thing. So, the first step is to have a conversation openly, like what we are doing. And I really commend Apollo and WebCare's platform to open up this Pandora box and to have this conversation so that many, many will benefit. I think if we talk about this to whoever are here, say 50 or 100, they will go and impart this and start up the conversation with another 50 and 100. It's a snowball effect benefiting so many around us. So thank you and commendable job on that. And it's our duty as women to look out for other women and keep them going because this is something all of us inevitably will face at some point of life. So, yes. So, setting that as my introductory preface to the whole session, women health problems not only constitute metabolic issues, cancer screening, other things related to physiological changes, but most importantly, pelvic floor and pelvic floor related issue. So when I mean pelvic floor, I mean the tissues and the support system which acts like a scaffolding surrounding the reproductive organs, which are happily and securely caged inside the bony framework of the pelvis. That includes the uterus, the cervix, the bladder, and the adjacent rectum and the anal canal as well. Now, these muscles and ligaments offer really strong support, just like a boat with an anchor in the water. If the anchor is lacking, or the moorings are lacking or weakened, or the water is not good enough to support, the boat sinks. It cannot stay afloat. Similarly, the pelvic organs are held and supported by the ligaments, which act like the moorings, the pelvic floor muscle, which acts like the water itself and keeps the whole pelvic organs supported. Should there be a laxity or weakening or lack of strength or extreme stretching of these pelvic floor muscles and ligaments, we then end up with lack of support to the organs, and these organs simply drop down. And that can lead on to a barrage of symptoms, right? From feeling of a bulge down below or a dragging sensation in the vagina and the private parts with constant backache or bladder and bowel disturbances. So bladder tends to cry itself out by either causing frequent urination, pain or discomfort during urination, or a feeling of sudden strong sense to rush to the washroom, and this fear that if they did not make it at the right time, they might even leak on the way. That's a pretty scary thing, especially for women who are multitasking between board meetings, traveling between places, and have to hold the decor and dignity in the presence of so many men. So it's really disturbing to excuse yourself from such busy schedule every now and then. And beyond that, if they cough, sneeze, laugh, or do exercises which involve weightlifting or kickboxing or dancing or jumping, which many of us are enthusiastic about with regards to fitness maintenance, that itself can lead on to what we call stress urinary incontinence. And though common, mind my words, though common, it is not normal. Something is not normal just because it is common. It has to be dealt with and it has to be taken seriously. And yes, we can make a difference in getting better control and even curing the problem if we address it earlier on. Bowel disturbance are also part of pelvic floor dysfunction, just like inability to completely evacuate the bowel, leading on to a sense of chronic constipation, or even inability to control the bowel in times of urgency where there can be fecal soiling. This is a problem which is pretty much brushed under the carpet and kept silent and smoldering for years, even by healthcare professionals. They do not come out with this because it's too embarrassing to talk about, and they reconcile to the fact, or resign to the fact that nothing much can be done about it at all without the proper knowledge or awareness about it. So they can experience sudden soiling because of urgency, inability to clean yourself completely, or frequent urgency of defecation, which can be quite troublesome. Apart from that, thing which is never talked about, these are things which are talked about least, but there is a domain which is never talked about. That is sexual dysfunction. That is also part of pelvic floor dysfunction. One, it's a taboo to talk about it because of the cultural beliefs and disbeliefs, may I put so. And for people who think beyond certain age, having sexual intimacy itself is an unheard thing because their elders never talked about it or complained about it. Again, something being common does not make it normal. Yes, continue to have sexual intimacy, and if there is a difficulty in either penetrative intercourse or pain and discomfort in the private parts or inability to do so, do need to be discussed and brought up in a discreet manner with your healthcare practitioner or your consultant gynecologist or whomsoever you're seeking help with. So that can mean we need to look deeper into the problem, and it can also lead us to find out whether the other domains of pelvic floor function are also okay before we go ahead and treat these. Recurrent urinary tract infection are also possible indicators of pelvic floor dysfunction. So that also needs to be addressed. So on the whole, maintaining a good pelvic floor health and hygiene and ensuring all the domains of pelvic floor function, namely the pelvic floor integrity, the bladder, the bowel, and sexual functions are all prim and proper, entails us to look at the pelvic floor health as a single domain. And these are various aspects in how we assess how good the pelvic floor is maintained.
So, doctor, I just wanted to ask you, so what would be the simplest, or, so let's first talk about this urinary leakage. And there's also some kind of, everybody knows that, there is some kind of exercises. People have heard of Kegel's exercises, but then is it something that, could you tell us a bit more about it so that everybody will know? And is there something that, it is not suitable for everyone?
Yeah. Urinary leakage is much more common than what we know or we can imagine. It's nearly about 50% of our women beyond the age of menopause can suffer from urinary leakage. And pelvic floor exercises, when I mean Kegel's exercises, where you tighten your pelvic floor muscle and then hold them and relax them, which are done about 10 to 20 times twice a day, can help strengthen the pelvic floor muscle, improve the tone and the capacity to hold far better than people who have never done pelvic floor exercises, and can play a crucial preventative role in preventing future development of incontinence as well as prolapse of the internal organs. So it is kind of pro health kind of situation where you teach your young mothers and sensitize your adolescent girls to the knowledge about pelvic floor and start teaching them the pelvic floor exercises as part of their abdominal core exercises. Typically, pranayama teaches you to integrate your pelvic floor along with your core muscles. So you lift and tighten them regularly when you do your diaphragmatic breathing. So young adolescent girls should be primed about it, should be sensitized about it. So we continue to do it lifelong.
So maybe you could just give our viewers a quick overview on what exactly Kegel's exercises are for people who are not aware of
Sure.
it. That might be a very practical thing to tell.
Yeah. Just to tell you very quickly how you should do it, you can lie down, sit down, and as you are sitting, just focus on your urinary part and the anal region and tighten the muscle, not just squeeze them, but try to lift those muscles up and bring them down. Lift them up, bring them down. Those are quick contractions, which are done for about 10 times. Now, tighten those muscles, lift them up, count up to 5, and release again. Again, do the same thing. This is about 5 to 10 times. So these kind of recruit both the fast muscle fibers and the slow muscle fibers, where you train both for resistance as well as strength. That improves the tone of the muscle and the capacity to contract better. A practical tip of how you can do it on the go. All of us visit the washroom about 6 to 7 times a day, or sometimes more, especially if you're hydrating yourself way too much. That time, if you're relieving yourself after doing so in the washroom, sit on the commode, take a couple of minutes, tighten the urinary part and the anal part 10 times when you're doing it, rapid squeeze and release, and another 5 to 10 times where you hold, count up to 5, and release. Every time if you visit the washroom and do it 10 to 15 times, you would easily clock 100 Kegel by the end of 24 hours. Imagine doing it every day. You will have the strongest pelvic floor muscle and would be devoid of all these problems in the future. That's a very practical way of practicing Kegel's exercises on the go without even having to think about a schedule or a prop.
Yes, that's a wonderful suggestion, Dr. Meera. I think we are also getting quite a few questions on our live chat box. But before we go to that, I just wanted to take up a question which I think will be also particularly relevant to this audience, which is going to be about work pressure, travel, sitting for far too long in meetings, and then somewhat, like I don't know whether some of us will also not always have access to washrooms. I don't know whether there is also some kind of a lot of road trips that some of them may be taking, or stress, work related, family related, food, all those things. So I just want you to touch upon pelvic health for this particular group of women who also have particular travel and professional commitments. And then look at our chat box and see what has come up, and then we'll move on to other aspects of pelvic pain and pelvic floor disorders.
Absolutely. With regards to this particular group, Yes, notorious for travel, notorious for sleep deprivation. Um, Even hydration becomes a challenge because of the continuous back-to-back meetings and the travel related due to time zones and stuff. And we're also guilty of taking the wrong type of fluids because of the meetings, especially caffeinated drinks or soft drinks which are aerated and fizzy, probably because of the need to be alert and difficult to go through all these board meetings at the same time, and difficulty in performing these exercises because of early hours of travel and prolonged meetings as well. The one myth I would like to bust at the outset is women harbor this belief that if they use public washrooms, they develop infections. That's the first myth I would like to bust, because UTI or urinary tract infection is not contagious. It does not come from using outside washrooms. It happens because of an overgrowth of abnormal bacteria in our own system. And the things which lead to that is inadequate hydration, i.e., lack of adequate water intake, constipation, tummy upsets, and holding on to the urine without voiding and visiting washroom for prolonged time, typically which happens in women who are traveling or busy with their work schedule. So postponing washroom visit combined with inadequate water intake is a perfect cocktail for developing a urinary tract infection, and public washrooms do not cause UTI. This is the first myth I would like to debunk. And the second thing is women in this particular group are potentially going to sit for long hours. As you're aging, as you go through the phases of menopause, because of the estrogen decline, the vagina becomes very dry and there's no moisture there. And constant pressure on the perineum gives rise to extreme burning sensation in and around the urethra and the private parts, and constantly a sensation to go and pee. But if you go to the washroom, very little urine is excreted, and you feel like going back again, back and forth. That leads on to frequent urination. Because it's combined with the sensation of discomfort, pricking, burning, people assume it is urinary tract infection and resort to multiple courses of antibiotics without any benefit whatsoever. If they land up with a urologist, they might even undergo procedures like a cystoscopy, which is a camera through the bladder, and even dilatation, saying that mouth of the urethra is narrow. They need to open it up to prevent these symptoms yet again. The fact is, because of the constant pressure on the perineum, they have this extreme dryness and excruciating burning or a feeling of heat down there, which is due to the vaginal dryness. And a proper examination with prescription of just vaginal estrogen cream will prevent these symptoms and alleviate all the pain and the burning. So very, very notorious to happen in people who are sitting for a long time, who are traveling, especially around the middle age and menopausal age group, and tends to get worse as more number of years pass out after menopause. So this is very, very important to understand. Wearing very tight undergarments, synthetic undergarments, tight denims and leggings can worsen these symptoms. So we also discuss about wearing loose cargo pants or skirts or more aerated undergarments to prevent this for them.
I'm going to pick up two questions that we already received. So I think let's not overrun the time. So this is from one of the participants who said that my urine tests are consistently showing a few red blood cells, around 3 to 6, and an ultrasound that shows very small kidney stones. Should I be concerned? And what should I do next? I mean, it seems to be a very specific problem that probably needs evaluation, but maybe a few quick words to explain this phenomenon.
The small stones will go away provided you hydrate yourself. If they are in the kidney, they're probably not the cause for these red blood cells. And these are very minimal red blood cells. which do not mean any sinister cause. However, there is frank blood or more than 10 to 15 RBCs in the blood that needs attention. Otherwise, hydrating yourself well itself could take care of this problem in the long run.
Right. And the other question was about another person who has a recurring pain in the lower left abdomen that radiates down to the knee along with frequent UTIs. So could these be connected and what should be done?
Could be connected because the left-sided pain is invariably due to constipation. And when there is constipation, as I mentioned earlier, your gut microbiome gets disturbed and that predisposes to recurrent urinary tract infection. And when there is this kind of picture, recurrent UTI can lead on to reactive arthritis and the pain can be noticed in the knee or the leg as well. Yes, all could be connected, and it's the first thing to be avoided is constipation by good hydration and getting high fiber in your diet.
Here's another related question about getting urinary infections. Now I'm okay, but even then, for some months, there are a few like 3+ RBC in the urine exam. Is that normal?
Actually, not normal. If you're not menopausal, if you're taking the test around that period time, in and around even for a week or 10, you can have this. But something not to be ignored. We need to evaluate further, make sure scans are done, and everything else is normal.
Okay, here's another question, which I think there are two people asking similar questions. One is about how to stop the urine leakage while sneezing. And also, yeah, that's about it. I think Kegel we've already discussed. Do I need to show to a doctor? Yeah, this is about the urine leakage while sneezing. And
Yeah. Evaluate with your consultant first because we need to make sure, as I mentioned, the other pelvic floor domains are all fine. Yes, if there is a violent cough or repeated bouts of cough or a big sneeze or vomiting, people do experience urinary leakage. That can be prevented by regularly doing Kegels exercises. But every time you sneeze or cough, if you contract your pelvic floor, which we call it as neck maneuver, you can avoid the leakage which can happen with the sudden increase in the abdominal pressure. Cough gives you some notice to do the neck maneuver. Sneezes, unfortunately, do not give you that notice time for you to be able to do that neck maneuver. But if you're a person who has allergic rhinitis or dust allergy, doing the neck maneuver prevents multiple leakages which can happen every time you sneeze. So that is something which you can watch out for. Actually, the good news is even 5% of weight loss, even if you're just a bit overweight, even 5% of weight loss from whatever weight you are reduces the incontinent episodes by 80%, be it due to urgency or due to stress urinary incontinence. So you can really make a difference to becoming dry by just losing 5% of your weight.
right. Tina here is asking whether any multivitamins or protein powders can be taken to strengthen the pelvic muscles. I don't think so, but we'll
No,
ask.
multivitamins don't do any help. Protein intake is generally done for strengthening your muscles, provided you work out those muscles. So, yes, you can take provided you do regular workouts.
Shreya, we don't know quite what you mean. Do we have to do exercise daily? I think Kegels, Dr. Meera has already explained. Do we have to do exercise daily? I would imagine
Definitely.
so. 5 days
Definitely.
a week. Yeah.
Yes. Yes.
I think, Dr. Meera, we will take up one more important area of pelvic health, which we touched upon earlier. So this again has come up in one or two of these questions. So this is about the pain during sexual intercourse. So could it be, so what kind of treatments are available for such situations? And when do they actually happen? Is it like only in the later age groups, or is it possible in a younger age group?
No, basically, we assess the impact of these pelvic floor health issues not only based on the symptom, we have very good validated questionnaires to assess how severe the problem is. Because at the outset, I mentioned none of these are life threatening emergencies, but do have a serious impact on the quality of life and do disrupt your daily routine, or you might have to change the way you do your daily routine to accommodate these issues. If it becomes troublesome, like you have to wear pads, or you have to wear diapers to get out, or you have to change your clothes twice or thrice, that is something which is impacting your day to day life and having a serious impact on the quality of life. That itself denotes it's a severe issue and which needs to be corrected. So this does not depend on the age. It depends upon the impact on the quality of life and impact on day-to-day routine. For a person who is sedentary, who lives at home, who does not get much out anywhere, this might be okay. Imagine a very busy professional who's a marathon runner. This might be troublesome even at the outset. So it individually varies and it depends on the quality of life they are having to manage with. So we do offer a lot of therapeutic interventions, starting from lifestyle measures. So lifestyle measures are done at the outset, continued throughout life. Just like we say, a dog is just not for Christmas, lifestyle changes are for life. They have to be practiced, one, in a preventative role, two, to maximize whatever interventions we offer, both be it medical, be it physiotherapy, be it surgical, to maximize the benefit of these interventions, to give it 100% success, we need lifestyle changes incorporated and practiced throughout. Say if I've done a surgery for incontinence at somebody at 50 and the person has gained about 15 kilos down the lane, she's bound to have recurrent incontinence despite the surgical intervention because weight obviously increases the pressure on the abdomen. So continuing to maintain a good weight and continuing to exercise, do your pelvic floor exercises is something which is non-negotiable. So that has to be continued. Avoiding excess caffeinated drinks, avoiding fluids beyond 9 to 10 p.m., having an early dinner, making sure smoking is completely quit. Smoking deranges the pelvic floor tissue, weakens the tissue, causes significant lung damage, can cause bladder cancer, and that is notorious for missing out in patients, especially passive smokers and tobacco users. So smoking and smoking cessation and quitting tobacco of any form is the first advice I give to all women with pelvic floor issues. And maintaining an appropriate weight is crucial. After that, we do offer them, or simultaneously, we do offer them Kegels exercises or pelvic floor exercises. Better to get evaluated, assessed with a pelvic floor physiotherapist, get supervised for a few sessions, and continue to do in the right manner further on. And subsequently, there are medications which can be given. No major side effects are there for these medications. They can be continued for a time period of 3 to 6 months and then be stopped and see how the effect goes. And if they are failing any of these medical options, we do have surgical intervention. Most of them are minimally invasive. They do not involve major surgery, but putting a tape underneath the urethra to support it like a hammock, just like we tie the shoelace up. So something like that, which can be done as a day case procedure, or injecting Botox into the bladder to prevent leakage due to urgency and frequency. So a variety of interventions are there in the armamentarium, which can be given depending on what exactly the person is suffering from and how far they are in the journey and how bad the impact of this problem is on their day-to-day life.
Here is another question about the pelvic floor muscles weakening. So, is it related to not having regular intercourse? And I think this might be a good opportunity to talk about the pain and the difficulties experienced in terms of what should be done if this is the case.
Lead to sexual dysfunction, and sexual dysfunction can lead to pelvic floor weakness as well, both. Because, as I mentioned earlier, vaginal dryness is an inevitable thing, which consequence of aging and menopause. And women who've had very early hysterectomy are prone for early menopause and subsequently develop severe vaginal dryness as well. And lack of intercourse further worsens this dryness, and narrowing of that lining and narrowing of the vaginal opening itself, and further perpetuates this problem. As they age, they can have difficulty in emptying the bladder as well due to this probability. And yes, sexual intimacy should be continued so they do not experience these problems. If you do experience pain, burning, or irritation, especially after intercourse, you need to approach your consultant and take help with regards to what is the main issue down there, or is it just lubrication and something can be definitely done about it to maintain good sexual health?
Again, there are more, so as it is necessary to drink more water. Okay,
I've spotted a question.
yeah,
Sorry, I
sure,
jumped
Dr.
the
Meera,
queue.
please go ahead. I'm
There is a
trying to
question.
read.
Estrogen cream is not given to females whose mothers have had cancer. That's a total myth. This is the problem when it happens with, um, I'm not being disrespectful, with influencers or not so-called experts giving advice on the whole about certain very important aspects. These are really specialist matters, and influencers or social media or general health advisors or nutritionists cannot advise these things or should not be advising these things. There is no contraindication for local estrogen therapy, even in persons who personally have had a history of breast cancer, because it does not affect the breast cancer per se, does not increase the risk of breast cancer recurrence in a person who has already had a breast cancer. So, where is the question of it being denied for somebody who has had a family history of breast cancer? So, that is
In
pretty much like
if I'm not,
punishing the woman
uh,
uh, and kind of, resigning to the fact this is how your life will be. It's
yeah,
not fair.
happens. And I also think, I mean, I may be wrong, but then isn't there like also a revision of some of these guidelines that even oral
Yes,
HRT
the FDA has lifted the
itself?
black box warning
Yeah,
on
yeah.
all these issues, including HRT, and we should not. There is no umbrella. I cannot tell somebody with a heart disease can never become pregnant. It's like having that kind of an umbrella rule. We cannot do that. So similarly, HRT or estrogen cream cannot be denied for each and every one with history of cancer or family history of cancer. The FDA has lifted off all the black box warning, and that's a welcome step because we now see women with breast cancer or uterine cancer surviving more than 20, 15 years. So they have a long life ahead. And in our country, breast cancer happens at least a decade or two earlier than the Western population, and many of them are premenopausal. So they still need to continue to have their sexual intimacy. They have their urogenital health to be worried about. They have their incontinence to worry about. And they need to be preventive with regards to their recurrent urinary tract infection. And one step is definitely local estrogen cream given under supervision. These are not over the counter. These are not to be bought online. These are not some hearsay medications you can use, but should be done under the supervision of your consultant, urogyne preferably, and has to be regularly monitored and surveillance has to be maintained.
Right. There's another question about itching. So that's another common problem. So the vaginal itching, which increases days before the menstrual cycle. And would it be what advice could we get for that?
days before the unbearable itching, that again could mean a decline in the estrogen levels, and that can predispose to fungal infections. Typically happens in breastfeeding mothers because there is a low estrogen level, or in some hormonal therapy, or well before periods. So using estrogen cream in that second half of the cycle, or making sure it is not a fungal infection and taking appropriate steps to prevent that and treat them, would be the way forward for that particular problem.
I think we need to also discuss prolapse, which is another condition that is not really talked about a lot. So this is, as you know, a kind of a feeling of being something coming down, a dragging sensation, or a feeling of heaviness in the vaginal in the private parts. So we will ask doctor to give us a brief overview on what this pelvic organ prolapse is, and even here, there are many treatment options. So let's quickly ask Dr. Meera to explain that to us.
Yeah. Prolapse, as I said, could mean something coming down, or a feeling of bulge or a dragging sensation. It is at various levels and various compartments due to lack of the support, or the pelvic floor itself becoming too stretched and lax after childbirth or pregnancy. Anybody who's had multiple vaginal deliveries or pregnancies, have had a traumatic vaginal delivery, say instrumental delivery, or prolonged labor, big babies, or inadequate recovery following normal deliveries, or far too quick return to manual work following a delivery, can be predisposed to such kind of problems. Weight gain, increasing weight gain, a hysterectomy done very early on in life can take off the support system there and predispose to descent of the bladder or the rectal wall, and that can predispose to prolapse. So it is important for us to recognize these symptoms and approach your consultant to have a thorough evaluation and see whether any of these organs are dissenting. It can be accompanied by difficulty in emptying the bladder fully, or difficulty in emptying the bowel. And many of these elderly women don't talk about it, but secretly do what we call manual digitation. They press on the prolapse towards inside or splint the perineum so they are able to relieve themselves. So this has to be secretly, discreetly asked. Do you do that to empty your bladder or bowel? And that can give us how severe the problem is and give an indication of what level of intervention we need to offer them. As I mentioned, Kegel's exercises are a preventative role and continue to do throughout life so further problems don't happen. Estrogen cream increases the suppleness, increases the vascularity, the healing capacity, and toning of the muscles, and prevents worsening of the prolapse. Avoiding lifting heavy weights. I don't mean weight training here. Those are done under supervision in a correct form. But generally, lifting all these bubble top bottles or furnitures or cylinders, elderly people who are already having hernia or prolapse should not do these, because that can itself worsen the prolapse. The classical subset of patients I see this is postmenopausal women who are babysitting, especially they've gone off to the US, they are NRI grandparents, and they are called in for babysitting. And babies nowadays are huge, and they continue to lift 10 to 14 kilos every time they go without doing any pelvic floor exercises. Or they're caring for their spouse who has been indisposed due to a neurological condition, or an elderly parent where they have to do all the caring, or they have a spastic child, or a child who has physical inability where they have to lift the child who has grown. Such weightlifting without proper attendance to their pelvic floor health definitely predisposes to prolapse in the long run. So we need to be aware of this kind of problems so that we can offer them the correct help. There are no medications which will help prolapse. Beyond, not all prolapse need surgery as well. So if they're manageable with, certain lifestyle practices, that can be managed, yes. If not, they will need surgery. And we have a variety of surgical options but one size does not fit all. It has to be tailored to that particular patient.
Here's a question, doctor. Can you please give us some insight on uterine polyps? Is it serious and would you suggest surgery for it?
Definitely. Uterine polyps are incidental findings sometimes. Sometimes we see it in patients with abnormal uterine bleeding. And these are thickening like grapes inside the uterine cavity. And most of them are endometrial polyps. You don't need to do a hysterectomy for them, but you need to do a hysteroscopy where you put in a camera through the uterus, have a look inside, take out the polyp, and you can then put in a coil which prevents further polyp formation depending upon the nature of the polyp. Typically happens in women who have been on tamoxifen, which is one of the hormonal agent which is given for breast cancer patient, and these need to be evaluated and removed because 10% of the polyps can lead on to malignancy or can be malignant themselves. So it is important for to assess every polyp and make sure they are not sinister.
We have one question which has come from somebody who's doing some wonderful work on the ground with women in low-income communities. So this would be so to them, they were requesting what could be very simple awareness messages that NGOs can teach women who come from less privileged backgrounds or rural backgrounds, uh, not very literate women perhaps. So how do you kind of give them the simplest message to recognize this pelvic floor problems is a question from them.
That's a very, very commendable thing, especially low socioeconomic status. The practices of pelvic hygiene or perineal hygiene sometimes can be inadequate, especially educating them about menstrual hygiene and safe sexual practices. Very, very important at this point. And second thing about their return to work, especially manual laborers. So teaching them pelvic floor exercises, especially after delivery, making sure adequate nutrition and anemia is corrected because these can affect the pelvic floor as well. And proper hydration. They are the ones who are loitering in the sun the whole day. They're not able to hydrate themselves well, and that can predispose to recurrent urinary tract infection. And making sure they do not ignore signs and symptoms because they always tend to put themselves last. So any blood and urine should not be ignored. They are the victims of passive smoking, so that also has to be borne in mind. Tobacco usage has to be strongly condemned because that itself can lead on to poor pelvic floor health and bladder disturbances. So all these are awareness messages. Any abnormal bleed, any persistent discharge, foul smelling discharge, any blood stained discharge, blood and urine is a red flag sign. Abnormal uterine bleeding beyond a week is a red flag sign and is not a sign of menopause. Menopause is irregular, scanty period. Continuous heavy bleeding, bleeding on and off, bleeding after intercourse, heavy bleeding does not qualify as menopause. These are red flag signs which have to rule out endometrial malignancy or cervical malignancy. So this has to be a key message which we can make sure the underprivileged women are aware. And most importantly, torchbearer for HPV vaccination, making them aware that the best gift they can give for their girl child is getting them vaccinated. And now the government has rolled it out. We debunking the myths about this vaccine is the best service we can offer these underprivileged society as well.
I think that's wonderful. I think we've kind of covered most of the areas of pelvic health. And I think it's also time to end the session. So first, thank you so much, Dr. Meera, for giving such wonderful insights with such clarity and warmth. And I think everybody is leaving this session with a lot of information, a lot of assurance. And I think they're going to be far less hesitant in seeking help for these pelvic health disorders. And to all our participants, please remember that this is something which we have learned today: urinary leakage, urgency, pelvic pain. Everything has a solution, and it doesn't have to be dismissed as just one more thing that is part of aging or motherhood or whatever. They can be dealt with, they are common, everybody has it. So there's nothing to feel embarrassed about. So do take help. Please don't self-diagnose. Please don't self-medicate. Please don't go by what you see on Instagram and YouTube from influencers, but take genuine, proper medical help from your healthcare provider and spread the message around that anything of the sort can be spoken about without hesitation. There are many options for treatment, and do, of course, take all preventive and lifestyle measures. Thank you so much for joining us, and see you again for our next webcast session. Meanwhile, stay well, stay healthy, and thank you from all of us at Apollo. Namaste.
Thank you so much.